Hello, I am Dr. Mugdha Raut, a gynecologist and obstetrician and a clinical reproductive immunologist. We have our centers, Dr. Raut's Center for Reproductive Immunology in Mumbai, Nagpur, Pune, Delhi, Bangalore, Hyderabad in India, and one international center in Kuwait, where, along with my husband, Dr. Mohan Raut, we treat couples with unexplained pregnancy losses, unexplained IVF failures, and unexplained infertility with our patented lymphocyte immunization therapy and other passive immunomodulatory treatments. Today, let us discuss the topic infertility and immunology. Are they interlinked? First, let us define or understand what is infertility. Infertility is a disease of the male or the female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility affects millions of people and has an impact on their families and communities. Estimates suggest that approximately 1 in every 6 people of reproductive age worldwide experience infertility in their lifetime. Now, in the beginning, let me tell you briefly about our immune system and its role in the body. Later in this talk, we will see how infertility and immunology are interlinked. As we all know, the immune system is our body's defense against any invader. It defends the body against a wide range of pathogens, including bacteria, viruses, and other microorganisms, and to altered cells of our own body. It is a network of cells, tissues, and organs that work together to defend the body against attacks by foreign invaders. Now let's discuss a little more about infertility. As I said before, infertility is a disease of the male or the female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility can be primary or secondary. Primary infertility is when a pregnancy has never been achieved by a couple, and secondary infertility is when at least one prior pregnancy has been achieved. So, what are the causes of infertility? Infertility may be caused by a number of different factors in either the male or the female reproductive systems. In the male-female reproductive system, infertility may be caused by tubal disorders such as blocked fallopian tubes, which are in turn caused by untreated sexually transmitted infections or complications of unsafe abortion, postpartum sepsis, or abdominal and pelvic surgery. The second cause is uterine disorders, which could be inflammatory in nature, such as endometriosis, congenital in nature, that is by birth, such as septate uterus, or benign in nature, such as fibroids. The third cause is disorders of the ovaries, such as polycystic ovarian syndrome and other follicular disorders. The fourth cause is disorders of the endocrine system, causing imbalances of the reproductive hormones. The endocrine system includes the hypothalamus and the pituitary gland in the brain, the thyroid gland in the neck, and the ovaries. In the male reproductive system, infertility may be caused by obstruction of the reproductive tract, causing dysfunctionalities in the ejection of semen. This blockage can occur in the tubes that carry the semen, such as the ejaculatory ducts. Blockages are common due to injuries or infections of the genital tract. It can also be due to hormonal disorders, leading to abnormalities in the hormones produced by the pituitary gland, hypothalamus in the brain, and by the testes. Hormones such as testosterone regulate sperm production. There can be testicular failure to produce the sperm, for example, due to varicocele or medical treatments that impair the sperm productions such as chemotherapy. Another factor is abnormal sperm function and quality. Conditions or situations that cause abnormal shape, that is morphology, and movement, motility of the sperm negatively affect fertility. For example, the use of anabolic steroids can cause abnormal semen parameters such as sperm count and shape. Then there are lifestyle factors which can cause infertility. Smoking, excessive alcohol intake, and obesity can affect fertility. In addition, exposure to environmental pollutants and toxins can be directly toxic to the gametes, that is the eggs and the sperm, resulting in their decreased numbers and poor quality. Sometimes all these factors can exist together. Remember, also it is not possible to explain sometimes the causes of infertility, and it is called as unexplained infertility. And in such cases, immunological rejection against a pregnancy can play an important role. So, now let's see more about the immune system and how it affects fertility. The immune system is our body's defense against any invader. It defends the body against a wide range of pathogens, including bacteria, viruses, and other microorganisms, and to altered cells of our own body. It is a network of cells, tissues, and organs that work together to defend the body against attacks by foreign invaders. And the embryo is always 50% mother and 50% father. That is, the embryo and the gestational tissues express 50% foreign antigens derived from non-identical father. And if donor egg, sperm or embryo is used, they will express 100% foreign antigens. So, the embryo is termed as a semi-allograft or a baby transplant. So then how does a pregnant woman manage to nourish with or grow within herself for weeks and months a fetus that is an antigenically foreign body by overcoming the powerful immune defense system? For this, we have to understand how the pregnancy bypasses the powerful immune rejection of a foreign body. The immune system has two functions. First is it is recognition of foreign antigens, and the second is its response. Immunological science has now come to understand a different aspect of the immune system called immunological tolerance to self, allogenic and other antigens. The destructive forces of the immunological army, known as a Th1 response, are balanced by the second arm of the immune system, known as a Th2 response, protecting the self as well as the fetus from rejection responses. At the time of recognition of antigens, the immune system has the capacity to divide them into friends and foes. If the introduction is friendly, then the second arm of the immune system, that is a Th2 response or immunological tolerance, swings into action and the immune system becomes tolerant to the antigens. This immunological equilibrium is important for protection against auto, that is self, and allo, that is pregnancy antigens. Any disturbance in this equilibrium will lead to autoimmune and alloimmune disorders. During the last 25 years, it has become clear that a large percentage of unexplained repeated pregnancy losses, miscarriages, unexplained repeated IVF failures, and unexplained infertility may be due to alloimmune cause. It has also been seen that these factors could coexist with the other known causes which I previously discussed. So, understanding how the maternal immune system reacts during pregnancy is very important because it helps us to treat pregnancy complications like unexplained infertility, repeated miscarriages, unexplained IVF failures. This can be achieved by proper immunological testing and subsequent immunological treatments like ImmuLIT done at our center and other passive immunomodulatory treatments. So, there is a simple 5-step process to follow. First is you book an online consultation call or visit us at our clinic. For this, you can contact our helpline number +91 9833201522. After the consultation, diagnosis of immunological cause can be done through immunological tests at our clinic or in your city. Once the investigation reports are ready, a follow-up consultation call is done with you by Dr. Raut's Center for Reproductive Immunology to confirm the need for active immunomodulation or ImmuLIT. The third step is ImmuLIT procedure is done at Dr. Raut's Center for Reproductive Immunology at one of their centers. It is done here as a single sitting 3-hour procedure where lymphocytes are separated and injected in the wife. No special pre or post procedure care is required. Embryo transfer can be done after 4 weeks or more. The effect lasts for up to 18 months. Fourth is a subsequent individualized protocol of the immunomodulatory treatment is given to be taken during embryo transfer and pregnancy. And fifth and the final step is enjoy parenthood. Thank you.